Hello everyone, this is Lisa from Power Wheelchairs for Success, and we are on to a new topic today. This topic has to do with money, which we all lack, which we all want more of, to be able to live a better life, of course. Our system and society is built on that. So one of the issues we have sometimes, those of us who need wheelchairs or have wheelchairs, there are little extra things that we need to put on the list of things we need. So we're going to talk today about where to get those things and how to get those things when we need them. One big thing I'm going to say, especially for people in the U.S., is to check your insurance. You know, I have a friend, I consider him a friend. I've watched a lot of his videos. His name is Shawns, and has a chronic condition, and he somehow went the route of seeking a donated complex wheelchair, and it didn't quite fit him, and he used it for a long time. And I'm just very glad for him that he went through his insurance this time and he got a chair made for him for his needs. So again, yes, it's not for free if you go through the insurance. It is not. You still have to either cover your co-pays or cover your deductible and co-pays. So you really have to figure out where you're at financially with your insurance, your medical insurance. So if you have difficulties covering your co-pays, then my suggestion is that you call the county. Here in the United States, there are what we call ADRCs or CRTs. They are agencies that help those with disabilities. So if you have insurance, but you realize that the co-pays are going to be high, call them and just say, I'm really in need of a new workable wheelchair, and I'm going to have to pay at least this much. Is there any ideas or organizations that can help me cover at least a portion of it? So insurance will cover if there's something that you need medically and you qualify, the insurance should be covering. They have to use the right codes and write it up correctly so it doesn't get denied. But yeah, call your primary care doctor or call your therapist or your neuro rehab doctor, whoever's in charge of your case, and just say, hey, I'm struggling with this or with that, and have that conversation to see if it's covered or not. That's why you have insurance. I see so many people, seeking a donation of a wheelchair. They have Medicare and they have Medicaid, and things are covered. So I realize that when a child of a parent jumps in and is trying to figure out how do I work the system, go to your parents' primary care doctor and say, hey, my dad needs this, my mom needs this, my uncle, I have concerns because of this. They will give you direction. A nurse should be calling you back. So don't give up on that sense. Most people here in the United States have insurance, whether it's private, whether it's state, whether it's federal, and go through that system first so that you can figure out what you qualify for. If you don't, then use the county and just say, hey, we already went through the insurance route and this is what they told us. The other piece that you can look at, sometimes we need cushions, and those need to be replaced at least every year. I didn't know that, but I was informed that my cushions need to be replaced a little bit more often. So, insurance sometimes covers parts. Sometimes they cover cushions, so check with your therapist first before you go out spending somewhere else. our cushions can be expensive because we need a certain shape, a certain form, a certain firmness, or a certain softness, and they can be expensive. The place I've been going is Amazon, and I really spend time picking out and looking at the shape, looking at the thickness, what kind of materials it's made out of, and then, I'll make an investment in that cushion. I haven't gone through my insurance for a cushion yet, so perhaps at some point, but I don't need it quite yet, but I do have an extra cushion to swap out so that I'm comfortable and so that I can wash the cover and all that kind of stuff. So that is, and then if Amazon, the insurance is not working, the county is not helping, then you do a GoFundMe, set up a GoFundMe. Find somebody to set up the GoFundMe for you. Our health is important, and we can't always expect for everything to be free. There is some work that we need to put into it. So do a GoFundMe, ask somebody to put up the GoFundMe for you, and go that route. So those are my 3 suggestions in terms of finances. It's really important for you to get what you need and to be comfortable, because if you're in a donated chair that doesn't fit you and you don't have the proper cushion for it, you could get sores and ulcers, and that's going to cost you even more, because you're going to have to go to the doctor, go to the hospital, and then it's going to be a longer recovery, and a difficult one at that. So put in your 5 cents, put in your sweat there, and ask the questions. It never hurts to ask. So if you don't ask, and the question just lingers forever, and you're sitting there suffering, that's not good either. Nobody's going to want you to be suffering. So reach out. I don't care if it's the librarian, sorry, I just hit something here. The librarian, or your neighbor, or your cousin, or your aunt, or your daughter, your son. I don't care who it is, but reach out and ask. You have needs. When we have our disabilities, we got to keep the foot on the gas and make sure that we have at least the basics to take care of ourselves. We are worth it. We have things to offer to society, to our communities, and to our families. They want us around, so for the most part. But for that, to participate, to enjoy life, you got to put in some 2 cents there and ask the questions. Even if you send me an email and say, hey, I need this, where do I go for it? That's fine too. That's what I'm here for. So, but it all can't be easy or done for you. You have to put in a little bit of time and sweat. Even though you might be in pain, you might be tired, but you got to take out some time to help yourself and to reach out to others who can help you reach for what you need. Your basics, and hopefully a little bit more. Okay? So think about that. Insurance is one. Okay, I can't find my camera here. Insurance first. County. Amazon, if you have the internet access, and a GoFundMe. GoFundMe would be last. If you're a citizen of the United States or a lawful permanent resident, you qualify for benefits. So you got to reach out and see what is the best route for you. So I can't say one or the other because everybody's case is different. But if you are a lawful permanent resident for more than 5 years, you would probably qualify for support. So think about it, plan it, reach out, and we're here. Your family is there. Your neighbors are there. Your friends are there. Ask. It never hurts to ask. All right. Take care, and I'll see you in the new year.